About 1 in 8 U.S. women will develop breast cancer in her lifetime. Ovarian cancer, 1 in 78. Obviously, a diagnosis is devastating, but we want to talk about ways to prevent and diagnose these diseases. And here with me is Dr. York. She is a health expert at Women's Care. So let's talk about how women can boost breast health.
Sure. One of the main ways is to limit alcohol. The more alcohol a woman drinks, the higher the breast cancer risk. Also, don't smoke and control your weight. The higher the body mass index, the higher the risk of breast cancer. If you choose to have children, consider breastfeeding. The longer a woman breastfeeds during her life, the lower her breast cancer risk.
Let's talk a little about ovarian cancer. I've heard that birth control can actually help with prevention, but what are some additional strategies?
That's true. Use of hormonal contraception, such as birth control pills, does reduce the risk of ovarian cancer. As little as 3 months of oral contraceptive use reduces the lifetime risk of ovarian cancer, and ovarian cancer risk continues to decrease the longer birth control pills are used. And that reduction in risk lasts for long after the birth control pills are discontinued. In addition, pregnancy at ages younger than 30 reduces ovarian cancer. And in terms of contraception, after childbearing is completed, tubal ligation or removal of the fallopian tubes does reduce ovarian cancer risk as well.
Unfortunately, if you're dealing with either of these cancers, if found early, how curable are they?
Well, the good news is that they are much more treatable if found early. For example, carcinoma in situ of the breast, or very early breast cancer, is 100% curable by surgery. Even later stage cancers are curable and manageable. Unfortunately, if cancers are diagnosed very late, we may be in a situation where they're not curable, but medical managements can still prolong life. The big message is that the earlier we diagnose, the more treatable and curable they are. And that's why we want to incorporate all of these strategies to find these things either before or at a very early stage.
When it comes to genetic testing, does it help to get tested if cancer runs in your family?
It might. If you have a strong family history of breast and ovarian cancer, then it may be helpful to you to know whether you carry a gene mutation which dramatically increases your risk of developing one of these cancers. A person who finds out that they're a gene carrier is eligible to have much more aggressive screening strategies than are recommended for the general population. And that may be helpful in both diagnosing early or implementing prevention strategies that could help someone to prevent them from having a cancer altogether. Some of the things that might be employed would be use of MRI in addition to or in place of mammography, or doing prophylactic or preventive risk-reducing surgeries, such as removing the fallopian tubes and ovaries, which reduces the risk of both breast and ovarian cancers, or even considering risk reduction mastectomy, which also reduces those cancer risks dramatically. Screening and prevention strategies should be individualized to a particular patient. So at Women's Care, we would like patients to come and see us so that we can get the right plan for them.
Great strategies. And for more information, go to womenscare.com. And of course, make sure to subscribe to our YouTube channel. Thanks for joining us.
Thank you.